Hi, and welcome to From Bump to Baby. My name is Ruth Godoy, and I'm a genetic counselor. In our first video, I briefly overviewed genetics, the difference between diagnostic and screening tests, and a growing genetic test important for mom and baby, non-invasive prenatal testing. In today's video, we'll look more deeply into an NIPT test, including the history of prenatal testing, how NIPT works, and the process of getting a genetic prenatal test. As mentioned in our last video, people typically have 46 chromosomes, which are arranged in 23 pairs. One member of each pair comes from the father, and one from each pair comes from the mother. Prenatal screening tests usually try to identify pregnancies at risk for trisomy 21, trisomy 13, and trisomy 18. With the advances in non-invasive prenatal screening in the recent years, it's now possible to screen for abnormalities in sex chromosomes. It's also now possible to screen for changes in what's known as microdeletions, which are small portions of missing genetic material involving several genes. These missing copies of genes have an impact on how a baby grows and develops, the severity of which is usually dependent on the number of missing genes. These conditions mostly also occur by chance, but can in some cases be inherited from a parent who also has the missing section of the chromosome. A lot has changed in the world of prenatal screening. In the past, prenatal screening relied on only the mother's age to determine how risky the pregnancy might be. In the 80s, it was recognized that a specific protein in the mother's blood, known as serum alpha-fetoprotein, could let us determine which women may be at higher risk of having a baby with Down syndrome, which would be more accurate than the mother's age alone. Over time, other markers have been added to the screen, and the number of conditions that are screened by a blood test has increased, and so has the detection rate. For an NIPT test, it's now possible to screen for many more conditions, and the detection rate is at the highest it's ever been. So how does NIPT screening work today, and why is this test not considered diagnostic? Non-invasive prenatal testing relies on the analysis of small fragments of DNA that are circulating in a pregnant woman's blood. Unlike most DNA, which is found inside a cell's nucleus, these fragments are free-floating and not within cells, so are called cell-free DNA. These small fragments usually contain fewer than 200 DNA building blocks or base pairs and arise when cells, mostly fat cells and white blood cells, die off and get broken down, and their contents, including DNA, are released into the bloodstream. During pregnancy, the mom's bloodstream contains a mixture of cell-free DNA that comes from her cells and cells from the placenta. The placenta is tissue in the uterus that links the fetus and mother's blood supply. These cells are shed into the mom's bloodstream throughout pregnancy. The DNA in the placenta cells is usually not always identical to the DNA of the baby because they both arise from the same egg and sperm union. Therefore, analyzing cell-free DNA from the placenta provides an opportunity to analyze for certain genetic conditions without putting the pregnancy at risk. The placenta's DNA can differ on occasion from baby's DNA, and therefore NIPT is not diagnostic because we're indirectly looking at baby's DNA by analyzing cell-free DNA from the placenta. Only a diagnostic test like chorionic villus sampling or amniocentesis can accurately tell whether a baby has the right amount of chromosomes or not. In comparing an NIPT to traditional screening tests, the most impactful difference might be in knowing when results are red, high risk, are real. In traditional screening methods routinely used today, you might know them as first trimester screen, maternal serum screen, serum integrated prenatal screen. Approximately 4 to 5% of women taking this test will screen positive. The majority of women who screen positive will not be carrying a baby affected with a genetic condition like Down syndrome. This is known as a false positive. Only a small proportion of these pregnancies, probably about 3.4%, will be affected with a genetic condition. This is known as a true positive. A false negative result example would be when the test says that there's a low chance of the baby having Down syndrome and the baby actually has the condition. Due to the high false positive rate with traditional screening, many women who have completely healthy baby receive a worrying high-risk result. This causes high anxiety and stress in the parents, leading them to make tough decisions about potentially unnecessary follow-up visits and invasive diagnostic tests. Since healthcare providers and scientists know that traditional screening is not very accurate, over the last few years, certain provinces and territories have decided to fund an NIPT for women who have a high-risk result through traditional screening. With an NIPT, the test is accurate 91% of the time, making it significantly more accurate and allowing healthcare providers and future parents to have more confidence in their high-risk or low-risk results. Even in low-risk pregnancies, the same rings true. NIPT is more accurate than traditional serum screening. If a pregnancy is considered high risk after an NIPT, remember, only a diagnostic test will determine for certain if the baby has or doesn't have a chromosome abnormality. So when does someone screen for genetic differences in their baby? Well, first, usually a woman will notice their missed period around 4 to 5 weeks and will likely take a home pregnancy test. During her first appointment with her physician or care provider, which takes place around 8 to 9 weeks, she may have an ultrasound to check for the baby's heartbeat and to get an approximate due date. At this point, the care provider should have a discussion with her on prenatal screening. Depending on the test, NIPT can be done anytime after 9 weeks, with results available 7 to 10 calendar days from the day of the sample reaches the lab. Traditionally, for women who do not undergo NIPT, they may have traditional screening, which varies from province to province of residence and could include a combination of blood work and early ultrasound as early as 11 to 12 weeks. This type of screening is covered in all Canadian provinces. Every woman is offered a detailed fetal anatomy scan around 18 to 20 weeks gestation to look for any other concerns with the development of the baby. NIPT screening, however, gives earlier and more accurate results. In low-risk pregnancies where screening results are normal, invasive testing can usually be avoided and delivery usually occurs around 40 weeks. Non-invasive prenatal screening is covered by the Ministry of Health of Ontario and in British Columbia at this time for women that meet strict eligibility criteria. In Ontario, Panorama is one of the NIPTs funded for high-risk pregnancies. Patients have access to private pay NIPT across the country, and some provinces have special funds to cover very high-risk patients. To find out more about how NIPT tests are available on the market and the differences between them, watch out for our third video in the series. Thanks for watching.